Hi, I'm Selene Daly and I'm a dermatology nurse specialist in Sligo University Hospital, and was on my pad talking about moles and where you should go basically if you have a mole that you're worried about. So we were just talking about not maybe going to a shop or a pharmacy to get your moles photographed, like a passport photograph, that you go to your GP who is qualified to look at your moles and refer you to the relevant consultant dermatologist if you need to have your moles examined. So we got a good few questions actually, they're really good. So we're going to go through some of them now.
So the first one is from Anne. So please ask Selene, is it okay to get electrolysis done on a mole?
It's a really good question, something I get asked an awful lot. First of all, I'll go to your GP just to ensure that the mole is normal and it's harmless, and that's fine. Hair can often grow from moles, and that doesn't mean there's anything wrong with the mole. One thing I wouldn't get done is something called IPL or laser hair removal on that, because when you do IPL laser, it can actually depigment the mole, and then if something happens to that mole, then further on down the line, your GP or consultant dermatologist won't be able to tell you if something is wrong with that mole. So certainly go to your GP, check that it's okay, and then you can get the electrolysis done then. And I don't envy you because it's so painful. If anyone's ever got electrolysis done, man, that's sore. So yeah, as long as your GP says the mole is fine, there shouldn't be a problem with that.
Great. So I have another mole question from another Anne. So I have a small round grey black mark near my cheekbone, slightly raised to the touch. Should it be checked?
The answer is definitely yes. So if you get anything on your skin that wasn't there before, that looks a little bit different, and we can talk about scaling or scabbing or itching or colour, if there's something there that wasn't there before, please go to your GP and get it checked, because when we catch these things early, they're actually not a big deal whatsoever, and we can treat them quite well and quite easily, and it's not scary. But if things are left for a period of time, then it gets a little bit more difficult. So definitely, Anne, I would say go to your GP whenever you can. Just go, have it checked. Even take a photograph with your phone. Most people have a smartphone now, and the camera is probably better on it than most cameras that you could buy maybe 5 years ago. So certainly get someone to take a picture of it, keep it, just so you can see yourself if it's changing, but go to your GP just for reassurance to say that it's all okay.
Okay, so we have some coming in from social. So this one is from Carmel. So very flaky eyelid, not sure what to apply. It's a bit angry looking.
Often this is dermatitis or eczema of the eyelid, or peri-orbital dermatitis or eczema. And there can be a couple of causes. Sometimes when somebody comes into our clinic with this dry, flaky eyes around the eyelid area in the eye socket, what we do is we do something called patch testing on them. So we see, are they actually allergic to something which is coming in contact with their skin. Recently I had somebody who we did patch testing on, and she was a glasses wearer, and there was nickel on the frame of her glasses. So it was creating or triggering off this dermatitis. This time of year still, because it was so horrible this week and so cold, and we had the heat blasted right up again, our skin dries out. So when we have that awful humidity inside, dryness inside, and then the cold dampness outside, your skin tends to just get dehydrated very, very fast. The first thing I would do is try a nice moisturizer. Now you can get an eye cream. I wouldn't get anything super fancy. I wouldn't get anything fragranced or perfumed. I would just go with something really bland. So eye creams from a company called Aven are really good. They have a really nice eye cream that's very nourishing and soothing. Give that a try for a few days. If it hasn't improved, go to your GP for a very mild topical ointment steroid. They can just rub on this to kind of, to stop the eczema from happening, and then continue on with with doing a bland moisturizer over this area. If it doesn't improve, ask your GP to be referred to your local consultant dermatologist, who can do this patch testing if needed.
So this comes in from Kira. So she says, hi, I have a small layer of skin that I have had frozen off my face twice. I can't afford a dermatologist at €150 to do this, but I have found a cosmetic skin clinic who has a cryopen. Yeah. And will do it for €80. Should I be wary?
This is cryotherapy, or it's liquid nitrogen. And in the pen, your GP actually would have histofreeze, as we call it. So it's almost like it treats things on your skin that are benign lesions mostly that we just don't want anymore. For example, warts are commonly treated with this histofreeze or liquid nitrogen. It's minus 190 degrees cold, and it freezes off unwanted lesions. Now, the most important thing though, however, is that you've established what's going on here. It's seborrheic keratosis. Is it a wart? That's fine. You can get that frozen off, no problem. But again, be sure that the first diagnosis is that this is a benign lesion to get rid of. Also beware that liquid nitrogen or cryotherapy, we do it, I do it myself. And the problem is that we have to be trained specially in it. And it's the one thing where it can go wrong. So when you spray or you treat an area of skin with liquid nitrogen, when you immediately treat it, it doesn't even look red. And it's like, oh, that's fine. The actual process of the action only happens about an hour or two into it, where the inflammation starts. Your body starts reacting to the burn effectively that's happened onto the skin. It starts to inflame, a blister can form, and it can even get hemorrhagic or blood blisters forming. So I'd be a little bit wary. I would be a little bit wary moving forward. I'd be interested to see what was the original lesion here. Is it seborrheic keratosis? Is it a wart? Yeah, absolutely. If it's a wart, your GP can treat it for 50 quid, if that makes any difference. Or if you've got a medical card or GP visit card, it's for free. So they have histo-freeze as well. And if you have a letter from the dermatologist that you had seen originally to say, this is a wart or seborrheic keratosis, hop along to your GP and say, listen, could I get some cryotherapy on this? And that's going to be even cheaper again and probably more accessible as well.
So this is from Bernadette, so she wants to know, for flaky scalp, what's the best shampoo?
This is a really common question, and it's something that I've had to visit myself this week. If I ever use, I don't have eczema, but I've always had a bit of a dry, scaly scalp. And sometimes it's an overgrowth of yeast that happens on our the skin on our scalp, basically. If I ever use dry shampoo, it's just game over. I get the most horrendous dry scalp. And again, it's a highly perfumed, that I shouldn't be using, but I'm desperate, a highly perfumed spray that you put into your hair, but it goes in your scalp and it creates this overrun of the yeast. This is my personal favourite, is Capicel shampoo. It's old-fashioned, it's smelly, it ain't glamorous. You put it on, wet the hair, but the most important thing is you put on your Capicel shampoo and you work it into your lather and you bring it right down over the front of the forehead, and you leave it there for 5 minutes. Now, I even set my phone, because when you're standing in the shower with shampoo in your hair, 1 minute seems like forever. So 5 minutes in contact with your scalp. Then you rinse it out and then you repeat the shampoo. So you actually do 2 shampoos with that, and then you can just put some conditioner on the ends. I find it's really effective. If it's super bad, and I think we had a question on the show with this, if it's super bad, go down to your GP who can get your prescription for topical steroid, which is safe to use in your scalp, because steroids in your scalp won't thin the hair. It actually encourages hair growth, would you believe, and doesn't thin that thick skin that we have in our scalp, but it gets you over that hump. And I have to say, if your scalp is dry and itchy and you have eczema and you start to scratch your scalp, it can actually trigger off a whole body reaction. It can make your whole entire body feel itchy, which is horrible. So do treat it. My favourite is Capicel shampoo. Again, it's a bit smelly, but it does the job. But if it doesn't work, get yourself a topical steroid on prescription from your GP.
So this is from Carl. So, hi Selene, I've been recently diagnosed with complex eczema on both of my hands and fingers. I've been treated with steroid cream, but my struggle is I've had this for over 12 months and I work in construction environment, so using my hands that get dirty. I always use gloves, but I find this doesn't allow the cream to work as I've washed my hands quite often. Any advice?
Yeah. This is a toughie, and I know if you have eczema or a background history of childhood eczema, it's always a good idea to be a thinker and not a doer, meaning that you don't use your hands. So if I have eczema and I'm a nurse or a beautician or a hairdresser or a chef or in construction, that's very, very difficult. So the first thing is you've got this diagnosis, which is great. The second thing I would say is I would ask to go and see a consultant dermatologist if you're not seeing one already, just in case that you're allergic to something which is coming in contact with your skin. Being in the building trade, cements, or I wouldn't be that sure on the actual ingredients in what you're using, but you can come in contact with some chemicals that can actually trigger off eczema. So that's one thing. You might be candidate for patch testing. The second thing is you're doing the great thing with the cotton gloves and to wear your other gloves over. So if you put on your steroid, put your cotton gloves on and then wear your work gloves over that. You said about washing your hands, and you're right. So there needs to be a total emollient therapy in place for people with hand dermatitis or hand eczema, whatever kind of eczema it is. So I would strongly recommend that you get down to your pharmacy and get something called the Elav hand wash. It doesn't contain any soap. You can never use soap again. So it doesn't matter if you're washing your hands after the loo, or you're at home, or you're at work. Do not wash your hands with normal soap. Get this Elav pump soap and wash with them, because there's no soap in it. It's paraben-free, preservative-free, and it won't strip your hands or dry your hands off. Put your steroid on twice a day until your skin looks normal, and use a moisturiser frequently in between. A top tip as well is to use when you're going to bed at night time. Again, you're only washing with Elav shampoo or Elav hand wash, but also use the Elav shampoo and the Elav wash in the shower, because again, that's going on your hands. You should never use any Radox, bubble bath, shower gels, nothing like that Pantene normal shampoo. That all goes out for you, and just get the Elav in. Elav completely, nothing else. before you go to bed at night time, put your topical steroid on, come along and soak those 2 hands in moisturiser, paraffin gel, emulsifying ointment, something nice and greasy. Pop your gloves over that, hop into bed. The last thing you do before you go to sleep at night time, when you wake up in the morning, those hands are going to be more repaired and it'll give them a chance to heal. Then in the morning, put your steroid on again, gloves on again, and then always wear your work gloves at work. But have that Elav wash in your pocket almost, if you can imagine, so that you use that when you're washing your hands after you're doing whatever with your building or you're going to the loo or whatever. So remember, the most important thing is you're taking all the normal shampoos, shower gels, shampoos, body washes, hand soaps out, and you're just putting all the Elav range in.
So this is from Mary. So I've been diagnosed with dermatitis. I've used Betnovate as prescribed, but it's still very itchy, so she switched to Aveeno. Should I take an antihistamine, or is there anything else that can help?
Right. So we're using Betnovate, which is a potent topical steroid. So again, just like the last texter, you can't use steroids in isolation. You must use them as part of a total emollient therapy regime. That's soap substitutes, moisturisers and steroids. That's those 3 things together, and they only work if the 3 of them are used together. So for example, if I'm using Betnovate twice a day on my skin, on prescription only, and I'm just using... I'm sorry to say brands here, but if I'm using VO5 or Pantene to wash my hair, I'm using Bubbly Wubbly, something I got for Christmas on my body, or, whatever it is, normal shower gel I use out that I buy in Tesco or Dunnes, that's going to bring me right back to my dermatitis, my eczema again. So you must never use ordinary soap. So what I tell my patients is, if I have diabetes, I can't have sugar. If I have diabetes, I can't have a Kit Kat or a Drifter bar or a big chocolatey Wackadoodle drink. And if you have eczema, you can't have soap. And it's that strict. So you can never use soap again. So you have to go home and clear out where your sink is, where your loo is downstairs, your ensuite, where your shower is, where your bath is. You have to take all those normal things out and you have to replace them with soap-free products. And Elav have that full range of soap-free products. Other brands that have soap-free products are Avène, La Roche-Posay, CeraVe, and they're available in big pharmacies all over the country. Care Plus Pharmacy, I know, has them all over the country, and the full Elav range in store as well. And I know they're nationwide. So get rid of the soaps and use the Betnovate in conjunction with it. Aveeno is fine, but Aveeno on its own isn't going to treat your skin condition. You can get loads of information as well on the British Association of Dermatologists.co.uk, their website, and you can get it on irishskin.ie. There's a big tab there on eczema. And if you click on YouTube and put in Dr. Alan Irvine, he has an amazing talk on eczema and why people have eczema and why we treat it the way we do. So that's a good one to look at.
This is from Colette. So my son is always complaining about his joints. He has to crack them a lot, including his wrists and ankles. He has dermatitis on the inside of his elbows. It can be painful sometimes. I've been to the doctor and he has no inflammation in his joints. How can I help him?
Kids do this, and I think you kind of get in the habit of cracking joints. I was never able to do it myself, so I don't know what it's like. But kids are growing and they're changing and their joints are looser, and it has nothing to do with the eczema. So it's got actually nothing to do with the eczema. It's just him growing. And, I don't think there's anything of concern here. If he's joint aches and pains, I wonder, is he like 12 or 13? Sometimes when they start shooting up, they can actually get joint aches and pains. Being referred to a paediatric physiotherapist is really good for this. And I know this myself because I did it with my own kid, that we went to the paediatric physiotherapist and her advice was, gentle exercises or taking a break. Sometimes, because kids these days, and it's a great thing, are exercising, they're out playing football, and sometimes they can maybe do a little bit too much exercise or too many steps in a day, and their joints can get a little bit stiff or sore, and especially if they're still in a growing phase. But it's nothing to do with the eczema, so don't worry that the eczema has caused this and making it worse. And if you have more concerns, go back to your GP and ask for a referral to a paediatric physiotherapist for your child.
Okay, so this is the last question we have time to. There's loads of questions that have come in, so you might get to them maybe. In the comments. Yeah. So this is from Christina. So hi, I have a redness around my cheek and nose which looks worse after the shower. I was prescribed steroid cream, but it really hasn't made a huge difference. It looks quite unsightly.
Right. This sounds more like it could be something called rosacea to me, and rosacea is redness and blushing and flushing of the cheeks and nose. Particularly happens when we get too warm. So if you have a warm shower, you can get this blushing and flushing of the cheeks and nose. Can sometimes be associated with acne as well, and you get a few pustules and papules with it. So the problem is, if it is rosacea, topical steroids are going to make it worse. So I would ask the question, have you got dry flaky skin all over? Have you a family history of eczema, asthma or hay fever, or a personal history of eczema, asthma or hay fever? And if you do, maybe yes, it is eczema, but it could also be rosacea. So if it hasn't made it better, I'd be kind of thinking that it probably is rosacea, which we have very good topical treatments for. The first thing to do is get down to your pharmacy. There's a company called Bioderma that make a range called Sensibio, which is all for rosacea, and it's absolutely brilliant. It comes in a cleanser and a moisturizer. It comes in a BB cream, which is brilliant. So you can try that, and also go back to your GP, because there are things on prescription only that you can use for rosacea. One is called Sulantra, that's been very successful, is ivermectin topically, and it brings the redness down of the rosacea. Rosacea is a difficult one, and certainly hot showers or topical steroids or anything like shampoos, it can really irritate rosacea and make it feel burny and very uncomfortable. So look up rosacea on the British Association of Dermatologists website. There's also a tab on irishskin.ie. Go and get that Sensibio range from Bioderma. Give it a try, see what you think, and go back to your GP and say, look, this steroid hasn't worked out. Is there something else you think it is? And that might help. So they're brilliant questions. Thank you. And I will get around when I go home back to Strand Hill. I'll get on my computer and I'll get looking at the questions, because they're brilliant and they really help other people as well, which is great. So thank you so much.